Can you see my presentation now?
Yes, please.
Okay, thank you so much for inviting me, Dr. Mohammed. The role of anti-VEGF in management of AMD fibrosis. My disclosures, and this is the fibrosis, is the end of AMD if you don't treat or don't treat well. And also we can see very well in the OCT, this hyperreflective material underneath the retina and over the RPE. And if any studies, after some years treating AMD, many patients, we're gonna present with fibrosis. And this fibrosis, we're gonna lose vision. Here, just shown some patients that was treated not well, and they still have a lot of fibrosis underneath the retina. And what is the appearance of fibrosis? If you go for a color picture, we're gonna see a white yellow, or in the FA, you're gonna be area of staining. But it's something that we have to care, because as I said, all we are doing in our patients is improve vision and keep the vision for many time. And then we can see, wow, I just lose my vision here in my slides. I don't know why. Yes, I can see here anti-VEGF treatment reduce.
Can you re-share, because we already lost the share?
Oh, okay, sorry. Because of that, we are losing everything here. I'm sorry. Okay, and then when you use properly the anti-VEGF, you can reduce this fibrosis. And the fibrosis is a world healing process, and we have risk factors that make this more pronounced, like type 2 neovascularization, the presence of intraretinal fluid, large fluid fluctuation, but very important, the shrimp, that's retina hyperreflective retina material. This is something that's really become fibrosis and the very prognostic biomarkers. And then after 7 years, Ivan, we can see that the patients lose in average around 4 letters in even treated well. And these patients, 79% has high reflective material, everything that's underneath the retina. We can see this as white in the OCT, and this means blood, this means the membrane, some fibrins and pigments, anything. And if the patients, very highlight this, if the patient has hyperreflective material, we're gonna predict that we're gonna lose vision. Here in the study, the average of the patient lose 10 letters after 7 years. And they also have a new name. They put draw in comparison of drill. That's what's draw is disorganization retina outer layer. That's mean when you have fibrosis, we lose photoreceptors. And then with these hyperreflective materials has different styles. We have 4 partners, and when you start to treat in this papered avenue, 76% of the baseline has the shrimp underneath the retina. And some are more dangerous than the other to finish because they don't get resolution and you lose vision. And how you treat these patients? And what do you mean? That we need to keep this treated well, because if you inhibit VEGF and other moleculars, like inflammatory moleculars, we keep this safe. And then we have the port delivery system that I have told you in my first presentation. There's many other studies that says that port delivery systems keep the treatment without many imbalancing, because we keep all the time with the same level of the drug inside the eye and then we keep the vision, we keep anatomically very stable if you compare to inject every month ranibizumab. And then we prevent fibrosis, we prevent loose vision. And if you see here, if you compare with monthly ranibizumab for 96 months, we have only 2.4% of patients with fibrosis at the end of 96 weeks. And then when you have the sustainable drug inside the eye, we can prevent fibrosis and we can keep the vision of the patient for a long time. And other drugs that promises is the vorolanib. Vorolanib is a new drug that is in the gel platform that inject in the eye. They keep the drug releasing anti-VEGF for at least 6 months. And also we have block not only VEGF, but also interleucin 6 that is inflammatory molecules that also induce fibrosis. And we have also many trials that prove that this new drug is very well. And we are in the process of Lugano and Lucia, the phase 3 trials to really sure that this is gonna help us. And this tyrosine kinase inhibitor, they promise a lot of reduction in fibrosis, like here 27% in mouses. They reduce the incidence of fibrosis 27% in comparison to control that was injected of ranibizumab. And also what we have the faricimab that blocks angiopoietin 2, that is inflammatory induction, and then they prevent this. If you see that's when you have patients with diabetic macular edema, the faricimab prevent the formation of epiretinal membrane. And at the end, we can say that if you better control the disease, if you maintain the treatment with the usual drug, but the new drug like the PDF, angiopoietin 2, tyrosine kinase inhibitor, all these, we get less activity of the disease, less fluid, less material underneath the retina, and control fibrosis that's gonna kill your vision after a while. Just invite you for Brazilian Vitreoretina Society meeting that's gonna be held April 17 to 20. Thank you, sorry for the delay.
Thank you very much, George. We can proceed and we can go to Dr. Susanna. Please, she will give a talk about role of anti-VEGF in proliferative diabetes.
Presentation.